Hello, the time is 11 a.m. Pacific, 2 p.m. Eastern, and I'm delighted to welcome you to today's AmericaWalks webinar, Inclusive Planning in Tribal Communities, Engaging People with Disabilities in Designing Safe and Accessible Transportation Systems. My name's Ian Thomas, State and Local Program Director with AmericaWalks, and running the webinar technology today is my colleague, Communications and Development Manager, Kelsey Card. We'd like to start by acknowledging that the land we now consider to be the United States of America was inhabited and cared for by indigenous people for thousands of years before European colonists arrived. I live in the modern state of Missouri, which was home to the Oto, Iowa, Missouria, Illini, Osage, Quapaw, and Chickasaw tribes, and I encourage you to research the indigenous history of the land where you live. This webinar is made possible through the generous support of our sponsors, the U.S. Centers for Disease Control and Prevention and their Active People Healthy Nation program, the Association of Pedestrian and Bicycle Professionals, MIG, BetterHelp, and the Everybody Walk Collaborative. We also have a special sponsor today, the National Center on Health, Physical Activity, and Disability, or NCPAD. Earlier this year, NCPAD awarded AmericaWalks a Partnership for Inclusive Health Innovation grant, whose goal is to improve accessibility and safety in tribal communities through more inclusive engagement with people with disabilities. Before I introduce today's program, I want to let you know that closed captioning is available under the tab marked Questions in your GoToWebinar control panel. And if you have questions or comments for the panelists, please type them into the box in that same area. We will address as many questions as we can during the Q&A portion of the webinar, and then post additional responses on the webpage with the recording. In this webinar, we're going to explore the topic of inclusive planning in tribal communities, engaging people with disabilities in designing safe and accessible transportation systems. And we have a panel of 5 experts in these fields. Hosky Benali is the Native American Disability Law Center's Community and Government Liaison and also serves on the Navajo Nation Advisory Council on Disabilities. Sherry Bozick is the Planning, Development, and Transportation Director for the Pueblo of Jemez in New Mexico. Kelly Buckland is the Executive Director of the National Council on Independent Living. Emily Schumann is a Director of the Rocky Mountain ADA Center. And Claire Stanley is beginning a new position as a public policy analyst with the National Disability Rights Network, having recently served as the Advocacy and Outreach Specialist at the American Council of the Blind. But before we get to the panel discussion, Yamelith Aguilar will present an overview of the white paper which she researched and authored for this project. Yamelith is a culturally responsive evaluator and researcher who is passionate about addressing social inequities through evidence-based efforts. At the U.S. Centers for Disease Control and Prevention, she developed innovative evaluation methods to measure the outcomes of emergency preparedness training activities, and she has worked on active transportation projects throughout the state of California. Yamelith's white paper, titled Inclusive Planning in Tribal Communities, Engaging People with Disabilities in Designing Safe and Accessible Transportation Systems, was published yesterday on the AmericaWalks website, and you should have received a link this morning to that publication. Hi, Yamelith. You were also a 2016 Walking College Fellow, and it's just great to welcome you back to AmericaWalks for this webinar. So please go ahead and take the screen share and tell us about your research and recommendations regarding inclusive planning in tribal communities.
Absolutely. Thanks so much, Ian. And thank you all for being here today. We really appreciate you joining us. The purpose of this project is really to advance inclusion of people with disabilities in transportation planning for tribal communities. By centering the lived experiences of people with disabilities, this white paper seeks to bring about changes in tribal government policy, planning, and design processes, which will lead to improvements in the accessibility of the built environment. Before I begin, I also just want to mention that the images used today are from the National Aging and Disability Transportation Center Gallery. Today, I'll be going over the project background, the methods we used, and highlight a few of the findings from our paper, as well as some recommendations based on those findings. We'll begin with a background. So to begin, it's important to understand cultural views of disability in tribal communities. There are 574 recognized tribes in the United States, according to the Federal Register, each of which has its own customs, cultures, and traditions. The word disability does not have a literal translation in tribal languages, and the closest meaning depends on the cultural context of each community. For example, the Hopi people from northern Arizona believe that any type of unwellness is brought on by the disharmony in the body, mind, or spirit. Alternatively, the Lakota tribe of South Dakota operationalizes the term disability to mean the failure of a society to garner the resources necessary for all people, regardless of their differences. In many indigenous cultures, physical and developmental disabilities are widely understood in a way that aligns with the social model of disability, in which the onus of the problem is on society rather than the individual who has a disability or their family, which is different than the medical model of disability, which states that the disability is on you and it's an individual problem. Regardless of the way disability is perceived, the data indicates that American Indians and Alaska Natives have the highest prevalence of disability of all racial and ethnic groups in the United States, about 30%, shown here in this bar graph. Next, I'd like to acknowledge the theft of native lands. Present conditions are always connected with history. Since 1492, when Christopher Columbus arrived in the Americas, indigenous peoples have suffered countless acts of violence and extreme injustice at the hands of the European colonists, including genocide, forced migration, and the theft of land. The passage of the Indian Removal Act, which was signed into law by Andrew Jackson in 1830, led to the Trail of Tears. Over a 20-year period, the United States government forcibly relocated about 60,000 Native Americans from their ancestral homelands in the southeastern United States to areas west of the Mississippi River that had been designated as Indian Territory. In addition to murdering tribal members, European settlers stole livestock, burgled communities, and occupied land that did not belong to them. Land theft and forced removal occurred throughout the United States. At this point, I would also like to acknowledge that I reside in Los Angeles, California, and currently on the native land of the Tongva tribe. Between 1769 and 1840, Tongva was irrevocably changed. The arrival of the Spanish with disease, invasive species, and livestock upended the ecological balance of the region and forced the Tongva to resettle around the three missions. This community still thrives today, despite continuing waves of colonization and cultural invasions by people from all over the world. And I just want to point out that if you don't know what land you're currently on right now, this website here is actually really great in putting together this GIS map of tribal lands in the United States as well as other countries. So I highly recommend visiting this website to learn more about tribal lands. So now I'll talk about the methods of this project. The first step in this study was a literature review, which was designed to identify articles addressing our research questions, and our research questions were around existing resources related to active transportation and accessibility for people with disabilities in tribal communities, finding existing walking and walkability advocacy efforts in tribal communities, what are the characteristics of typical disability advocacy groups and typical transportation planning processes in tribal communities, gaps in resources and local capacity to conduct inclusive engagement in tribal transportation, and we wanted to find current opportunities for developing more accessible places. We also formed a project advisory board that we have here today with us of subject matter experts to assist in the planning and implementation of this project. Our members of the project advisory board are professionals and advocates in accessibility, disability rights, and inclusive practices and policies, as well as experts in tribal community health, planning, transportation, and safety. We then conducted key informant interviews with all the members of the Project Advisory Board, as well as 5 other experts in the areas of accessibility, disability rights, inclusive practices and policies, tribal community health, planning, transportation, and safety. Based on the comprehensive literature review and the key informant interviews with the 11 subject matter experts, a number of themes emerged in response to the research questions. Today, I'll go over just a few of the key findings from the white paper. You can find a more extensive list of our key findings on the white paper available now on the America Walks website. First, we're going to talk about accessibility in tribal communities. The first theme was really around the fact that many tribal communities lack basic infrastructure for walking, biking, and rolling. Many tribal communities are often in very rural lands, which includes high-speed highways cutting through communities, a lack of safe sidewalks, and limited lighting. However, our key informant interviews and many of the project documents we reviewed explained how, despite inadequate pedestrian infrastructure, community members of all ages and abilities are walking, biking, and rolling, often long distances, to reach their schools, clinics, and other destinations. And it was often mentioned that this has led to many pedestrian fatalities and injuries. Native people are vastly more likely to be killed while walking than any other racial ethnic group, with a per capita pedestrian fatality rate more than 4.5 times the national average. Next, we found that the American with Disabilities Act of 1990 is not consistently enforced on tribal communities. Federal law recognizes the sovereign authority of the Native American tribes to govern themselves. An important aspect of sovereignty is a doctrine of sovereign immunity, where in most situations, state and federal courts do not have the jurisdiction to hear private lawsuits brought against Native American tribes. It has largely been assumed that Congress specifically excluded Native American tribes from the ADA. However, Title III of the ADA, which prohibits discrimination of people with a disability from any place of public accommodations, gives the U.S. Attorney General the power to file a civil lawsuit to urge a tribe's compliance with the regulation. In addition, state governments do have to follow the ADA, even if the road is on tribal lands, and so the law does apply to the Department of Transportation highways and other projects using federal funding. We largely found that protections for Indigenous people with disabilities varies from community to community. For example, the Navajo Nation passed the Civil Rights Act in 2018, which mirrors the ADA by requiring that Navajo people should not be discriminated against and should be given every opportunity to participate politically, economically, and socially in the Navajo Nation. We also found other legislation that may apply to tribal communities, like Section 504 of the Rehabilitation Act of 1974, which states that no individual should be excluded from participating in any program or activity receiving federal financial assistance, or by any program or activity conducted by any executive agency or by the United States Postal Service. And we also found the Individuals with Educational Disability Act and Every Student Succeeds Act, which protects tribal members with disabilities in educational facilities. Accessible funding does not prioritize safety or accessibility for active travel. Key informants and members of the Project Advisory Board explain that funding for safety and accessibility projects is difficult to acquire. Most federal transportation grants are provided for the construction and expansion of roads for cars. When funds are set aside for pedestrian, bicycle, and accessibility improvements, the cost of maintenance often becomes an unexpected and unplanned financial burden, as the quality of the trail surfaces or roadways degrades and deteriorates over time. We'll now talk about inclusive engagement with people with disabilities. Our first finding here was that intentional outreach efforts to engage people with disabilities in planning processes are rare. Outreach and engagement with people with disabilities is a vital component of creating a safe and inclusive built environment. However, key informants and members of the Project Advisory Board reported a lack of intentional community engagement effort to reach people with disabilities in tribal communities. Similarly, very few references to the involvement of people with disabilities in project planning and designs were found in the literature, despite a comprehensive document research review process. Now, I want to mention this does not necessarily mean that organizations are not including people with disabilities in their tribal communities in their engagement efforts. However, it is not intentionally reported on or shared on public reports about their engagement efforts. Our last finding today states that public health data and research into transportation needs for people with disabilities are lacking. There's a lack of available data about American Indians and Alaska Natives with disabilities and their mobility needs. It was mentioned by our subject matter experts as well as in the literature how there is a lack of accurate data on disabilities and all aspects of public health in tribal communities. Additionally, it is widely believed that Native people are severely undercounted in public health surveillance systems. So now I'll move on to our recommendations from our white paper. We'll begin with recommendations about community assessment. Our first recommendation is to organize mobility audits. An excellent starting point for planners, community health representatives, and people with disability and advocates is to organize a program of mobility audits. A mobility audit is a specialized type of walkability audit, which focuses on mobility barriers and solutions for people with disabilities. It is recommended that a small group, including at least one person with a disability, plans and leads the mobility audit. We recommend beginning your mobility audit process by using already existing audits like the AARP Walk Audit Toolkit and adjusting to fit the tribal community you're working with. Our next recommendation is to conduct more research into prevalence and needs of people with disabilities. Tribal planners need reliable information about the people who will be using public facilities in the community. Unfortunately, as mentioned earlier, there's a lack of available data about disability and public health among American Indians and Alaska Natives. Therefore, it is recommended that planning and public health professionals conduct systematic investigations of the prevalence and specific needs of people with disabilities in tribal communities. Epidemiological studies of the entire spectrum of physical and developmental disabilities would provide valuable information for engaging with people with disabilities. Our last recommendation in this bucket is to incorporate local data into state and federal funding application. One of the best practices shared by our subject matter experts was to include local data into grant funding opportunities. Applications for federal and state grants should include local data such as crash statistics, fatality reports, and active transportation road usage as available. Fatality data can be found in the Fatality Analysis Reporting System, or FARS, and it's also recommended to engage volunteers such as local community members or local college students in the counts of pedestrian, wheelchair users, and cyclists. Our next bucket of recommendations falls under advocacy, planning, and policy. Our first recommendation is to build a local advocacy movement. People with disabilities and advocates for people with disabilities in tribal communities should organize to encourage improvements to better meet their mobility needs. A local advocacy movement can be launched by building partnerships between interested individuals, community groups, and tribal government programs, such as housing, public health, elderly services, vocational rehabilitation, and social services and colleges as well. We recommend designing an inclusive and accessible public engagement process, which uses a variety of strategies. Public engagement is an essential component of planning activities in tribal communities and elsewhere. However, if the engagement process is not intentionally designed to be inclusive and accessible, the voices and experiences of people with disabilities and other marginalized groups are likely to be excluded. Community engagement methods and materials must be developed with an understanding of all the different types of disabilities. There is no one-size-fits-all approach because people experience with disabilities related to cognition, mobility, hearing, vision, independent living, and self-care, among others. For example, project web pages should be accessible to screen readers and have easily adjustable font sizes, contrast, and brightness, while live and recorded presentation should be accompanied with sign language interpretation whenever possible. Finally, it is important to incorporate the native language or languages when conducting any community engagement activity. Although English is widely spoken in many tribal communities, key project documents should be developed in a dual language format, and interpreters, as well as sign language interpreters, should participate in community meetings whenever possible. We recommend developing a built environment mobility improvement plan in partnership with people with disabilities. After completing an inclusive engagement process, planners should work with tribal community advocates and people with disabilities to develop a built environment mobility improvement plan. Use mobility audits to conduct an initial needs assessment of the tribal community, which centers the experience of people with disabilities. Based on that information gathered, identify a few specific place-based projects which will have the most beneficial impact for access and mobility. Over time, and in conjunction with ongoing inclusive engagement activities, develop a comprehensive plan for built environment improvements, which will enable people with disabilities to navigate their community independently. Our last bucket of recommendations here is around engineering design. We recommend ensuring projects address accessibility for people with all types of disabilities. Project engineers should consider a wide range of functional design elements which improve accessibility. For example, audible pedestrian signals and tactile street warnings are very important for people with visual disabilities, and enhanced pedestrian lighting and sidewalks are mitigators of vehicle-related deaths. And the last recommendation we have for y'all today is to incorporate cultural elements into the design of the mobility projects. The design of mobility and active transportation projects should include the voices and opinions of the tribal residents, as well as those of people with disabilities. Tribal historians, cultural anthropologists, naturalists, and artists can contribute substantial improvements to the design of trails and other infrastructure projects. So that's the last recommendation we have for you all. At this moment, I'd like to encourage you all to take a moment and read through the white paper that was developed as part of this project. Again, that's available on the America Walks website now. Now I'll turn it over to the panel discussion.
All right, thank you so much, Yamelith, for that presentation. And please do stick around and come back when we get to the question and answer phase towards the end of this webinar. I'd like to now invite our panelists to switch your cameras on so that everybody can see you and we can have our panel discussion. And for the audience, just a reminder that if you have a question or a comment, then go to the questions tab in the GoToWebinar control window to the right of your screen and type it in there. And after we finish our panel discussion, we will address as many of those questions as we can. So I do want to welcome Emily, Kelly, Sherry, Hosky, and hopefully Claire will be able to join us in a minute. These were the members of the project advisory board for this project, and one member of that board who wasn't able to be with us today, but whom I want to acknowledge and thank for her work, is Sharon Hausen, the planning program manager with the Pueblo of Laguna. So I want to just start the panel discussion, ladies and gentlemen, by asking each of you to introduce yourself and briefly discuss your work and the intersection of that work with this project around inclusive planning in tribal communities. And Kelly, I know you're a busy fellow and you are going to have to kind of leave before the end of this. So let me go to you first. You're the Executive Director of the National Council on Independent Living. Just tell us a little bit about independent living and how your work relates to this project.
Yeah, thanks, Ian. I am the Executive Director of the National Council on Independent Living. We go by NICL. We are a membership organization for Centers for Independent Living and statewide independent living councils. There are about 715 locations of Centers for Independent Living across the country. They're all private, not-for-profit, non-residential organizations that provide services to people with disabilities. There's an array of services, but I won't go into that because I know we don't have the time. But and the statewide independent living councils are gubernatorially appointed bodies. There's 56 of those, 50 states and 6 territories. And they're kind of the planning body, and they design what the network of centers look like. So we serve people with disabilities, and we are staffed, and the boards are made up of a majority of people with disabilities. So if you will, we're kind of like organizations run by people with disabilities, staffed by people with disabilities, and we serve people with disabilities. And like I said, there's about 700 locations, and a number of those are adjacent to native lands and do outreach or provide services to tribal members on native lands and do some work with tribal government. And so this intersects well with us. I mean, we have seen a lot of the problems that were outlined in the report, and so it's really good to kind of see the recommendations that came out of this, and I wholeheartedly support those. And with that, I'm sorry, Ian, but I do have to go to another presentation. So, but I'm sorry I can't stick around, but I wish you all luck, and I'll look forward to working with you further.
Well, thanks so much, Kelly. Really appreciate all your work on the project and on the white paper. Great. Well, let's move to Emily Schumann. Emily, you are a director with the Rocky Mountain ADA Center. Just tell us about the ADA and the work of the national network of ADA centers.
Sure. Well, thank you very much for having me, and thanks everyone for being here. The ADA is a comprehensive civil rights law, the Americans with Disabilities Act, that protects people with disabilities from discrimination in areas of public life, so places of public accommodation, employment, state and local government, things like that. And the Rocky Mountain ADA Center is just one of 10 ADA centers in the country that provide information, training, and guidance on the Americans with Disabilities Act. So all 10 centers put together are referred to as the ADA National Network. The Rocky Mountain Center serves Region 8, which is Colorado, Montana, Wyoming, North Dakota, South Dakota, and Utah. So our region has a large tribal population, and that's why we have an interest in this project and why we find, a large intersection there. But some of the services that we provide are training to businesses and individuals, governments, things like that on the ADA, on their rights and responsibilities. A large part of what we do is providing technical assistance or answers to questions. So folks who have questions on the ADA, what their rights or responsibilities are, can give us a call, and our team of experts can answer those questions or help point them in the right direction if they need to take further action. And we do a significant amount of research ourselves. So we do research into how the ADA applies to certain areas, such as vacation rental properties. We've done some research into the application of the ADA on tribal lands, things like that. So I will wrap it up there and pass it on to the next one.
Yeah. All right. Well, thanks so much, Emily. Let's go to Sherry Bozick. Sherry, you're the Planning, Development, and Transportation Director at the Pueblo of Jemez. Tell us a little bit about the community and about your work there.
Great. Yeah. Hi, everyone. Thanks for having me. So my department, we are responsible for overseeing all of the planning, design, and construction projects, all infrastructure projects at the Pueblo of Jemez. The Pueblo of Jemez is located in northwestern New Mexico on about 90,000 acres of 3 non-contiguous parcels of land. The population is just under 4,000. Currently, our department is designing a 2-mile trail, pedestrian trail project. So that is how some of my work intersects with this project. Is we are working with engineers and the community to design a fully compliant ADA compliant trail with some challenges involved. There are steep slopes and things like that, but we're going to do it, and it's going to take a little extra work, but it's meaningful. We want to make sure everyone in the community can use this trail because it connects all of the services through the Pueblo. We are also designing and constructing parking lot projects, reconstructing parking lots that are on steep slopes, especially the parking lots surrounding our local clinic, so that all tribal community members can have easy access into the clinic. And then we're in design on a few other projects, a bridge that will be replaced over one of the rivers. And so in all of our projects, we are working to be including the folks, everyone in our community, and designing new infrastructure that everyone can use.
Mm-hmm. Great. Well, thanks, Sherry. I had the pleasure of visiting Jemez last year and saw some of the challenges that people have for getting around the community, but tremendous leadership in the community to win this grant and build this trail, and lots of other projects going on. So congratulations.
Thanks so much.
So I'd now like to introduce Hosky Benali, and Hosky, you sort of bridge these two different areas of national level disability advocacy on the one hand, and tribal community leadership and action on the other hand. So please just take a minute or two to tell us about your work with the various organizations that you participate in.
Yeah,
We can hear you.
which means hello in Navajo, and means literally, translation is everything is good. My name is Hosky Benali Jr. I'm a Navajo. I'm visually impaired, resulting from retinitis pigmentosa. I'm the community and government liaison with the Native American Disability Law Center out of Farmington, New Mexico. And the law center that I work at, we provide services to individuals with disabilities in the Four Corners area, which is Colorado, Utah, Arizona, and New Mexico. And we provide community education, referrals, and free legal services, ensuring that those with disabilities are not discriminated against. So also I'm the president of the Navajo Nation Project Council on Disabilities, which is a council within the Navajo Nation government to ensure that the government does not discriminate against Navajos with disabilities. And so I'm also involved with the Native American Congress. So that's who I am, and thank you.
Yeah, thank you so much, Hosky. And our fifth panelist is Claire Stanley. I think we've had some technical challenges with Claire's connection, but Claire, are you on audio right now? I'm not hearing Claire, and the microphone symbol does not seem to be lit up. So Kelsey, if you...
Hi, Ian, can you hear me now?
Ah, there we go. Wonderful. Yes. Hi, Claire. So we're just doing introductions, and just tell us a little bit about your work, both your previous position with the American Council of the Blind and what you're looking forward to with the National Disability Rights Network.
Thank you so much, Ian, and I apologize for the technical glitches.
Not at all.
Like Ian said, I currently work for the American Council of the Blind. We're a membership organization of persons who are blind or visually impaired, as well as others, all across North America, and we advocate for the rights of people who are blind or visually impaired. We're constantly trying to reach out to greater communities, including persons who live within the Indian nations. So it's a great opportunity for us to be involved with this. We do two main things at ACB. We bring together people who are blind and visually impaired to bring people to build communities, to be able to support each other, to advocate together, to support each other. And then we also do a lot of work at the congressional and legal and administrative level. So we're always advocating for the rights of persons who are blind or visually impaired. I'll be doing similar work with the National Disability Rights Network, but on a bigger basis for all disability groups. Advocating again, I'll be a public policy analyst, so advocating at an administrative or congressional level to make sure that persons with disabilities are thought about when we're making new policy and when we are working with federal agencies.
Great. Well, thank you very much, Claire. So I want to jump into our discussion, and Hosky, I'll start with you. I'd like to learn a little bit about cultural views on disability. As a person with a disability for most of your life and a tribal member, and devoted your career to advocacy, what's your understanding of cultural views of disability within your community?
Well, all tribes have their own teachings and their own concepts of disability. But as far as Navajos, we believe that Navajo with disabilities are special people. And that goes back to one of our Blessing Way stories, in which they call Early Dawn Boy. And at one time, he took care of a number of young people who had disabilities because their parents had just put them in one place and felt that they were a burden. And eventually, these children were taken back by the holy ones. They call them the spirit people because they weren't being taken care of. And the teaching there was that all people should have passion for individuals with disabilities and have the attitude of early Dawn boy who was the one that rescued all these children with disabilities. And so that's our concept of from the Navajo Nation as far as how we look at people with disabilities.
Seem to have audio interference. Well, thank you so much for sharing that story, Husky. Sherry, you're a tribal member in Jemez. Anything to add to what Husky said?
Actually, I'm not a tribal member.
I apologize.
Of Jemez. I work here as a staff, but from what I'm observed, there is concern. What I observe at Jemez, there is concern by leadership to address some of the infrastructure here to accommodate more of the folks with disabilities. Culturally, I can't speak from that perspective because I'm not a tribal member, but I know that the leadership, they are supportive and advocating for considering the people with disabilities more and thinking about them when we're planning future development at the Pueblo.
Okay, thank you for that. Either Emily or Claire, as you've worked through this project, working with Husky and others, have you noticed any distinctions or made any observations around cultural attitudes to disability that may be relevant for this project?
Well, I can just say that I think that the understanding that disability is more of a social responsibility, that sort of belief among tribal people is quite different than I would say, people within the states typically believe. And so I think that probably has a big impact on how they look at accessibility and how they evaluate their needs.
Mm-hmm. Yeah, the social model versus the medical model. Well, let me go to Claire now. And Claire, I'd like to move on and start talking about the Americans with Disabilities Act and the Rehabilitation Act. Can you just give us sort of an overview of those pieces of legislation and how they may or may not apply in Indian country?
I apologize. Can you hear me now, Ian?
Yes, can hear you.
Yeah, so the Americans with Disabilities Act is a federal piece of legislation, as well as the Rehabilitation Act, and they are extremely similar, but the difference is the Rehab Act came before the ADA. It came in 1973, and it only applied to things that received federal funding. Then in 1990, the Americans with Disabilities Act came along, and it also required accommodations for persons with disabilities, but at the state and local level. And so it's important for us to talk about that because it applies to state and local entities as well as the federal government if we're talking about the Rehab Act. And so in tribal nations, the ADA doesn't necessarily apply. Now, I know it was talked about a little bit earlier by Yamelith and Hosky and a few people that there are exceptions. It's not a completely blanket rule, but in a lot of circumstances, it doesn't apply. Neither laws apply. So it makes it interesting with these discussions because we want to use the same types of ideals and policies and procedures, but if the ADA doesn't apply, we don't quite have the same stick that we might have, so we have to use the carrot. Now, one important thing for this work is that I believe, again, Yamelith had talked about for transportation issues under Department of Transportation, if you have a federal highway or things of those natures, the Rehab Act, I should say, does apply even if you're going through a tribal nation. So it gets a little bit messy when a lot of times people think, oh, the ADA applies everywhere. Well, no, that's not the case. You have to really look into where laws do and do not apply.
Well, thanks, Claire. And Sherry, you are in the process of developing a project with federal funding. Anything you want to add to what Claire just said, and how does the ADA apply to you?
Yes, so all of our large projects, and transportation projects are very expensive, usually $1 million a mile to construct a roadway. With our trail project, that's a $5.5 million project, including all of the planning and design and construction. All of our large projects are funded federally. Jemez is a non-gaming tribe, so there's not there aren't casino funds being used or gaming funds being used for this project. So yes, we are mandated to meet ADA. We want to as well. There's no pushback to that. So all of my projects in the transportation side of things will always meet ADA due to their funding source. But when we do other projects, in the future with other funds, if we get them, whatever other grant funds, we will always make an effort to meet ADA compliance and to install features that are promoting the mobility of disabled people.
Great, thanks, Sherry. Now, Husky, I believe that the Navajo Nation has developed its own legislation or guidance. Tell us a little bit about that.
Yes, we have what they call the Civil Rights for Individuals with Disabilities Act of 2018. And basically, although ADA doesn't apply on the Navajo Nation, this piece of legislation follows pretty much along the guidelines of ADA, but we don't say that it's ADA. Example, non-discrimination in housing, education, services, even accommodations for Navajos with disabilities who have been incarcerated. And so prior to that law, they had a similar law, but the law did not have consequences or legal consequences for noncompliance by departments and divisions and other public entities on the Navajo Nation. So that was also a big part that was put in there, was that there are going to be legal consequences for noncompliance and discriminating against Navajos with disabilities. And the law center that I worked for provides legal consultation and legal technical assistance to the Navajo Nation Advisory Council on Disabilities. And so that was a joint effort that we continue to work on.
Let's talk about inclusion. And Emily, I'll start with you, if I may. Just outline what you consider to be best practices in terms of inclusive engagement with people with disabilities.
Sure. So, some things that come to mind, especially in this sort of new world of virtual meetings and Zoom and webinars and all of that thing, is really making sure that effective communication is in place. So making sure that people with visual disabilities, who are deaf or hard of hearing, all of those types of disabilities have been taken into consideration and accommodated. So, that's everything from providing captioning on webinars or community meetings, for example, providing a transcript after the fact. There's all kinds of technology that can be put in place during community engagement meetings in order to make sure that everybody can be included.
Yes, thanks. And Claire, as a person with a visual disability yourself, anything you want to add to that around inclusion?
Sorry, I'm horrible at unmuting myself. One of the things
No, it's very difficult.
One of the things that first came to mind, Ian, when you first started talking about this idea of inclusion, is a phrase you'll hear a lot in the disability community: that's nothing about us without us, meaning when any type of policies are being developed or new projects or whatever it is that's going to impact the disability community, us, meaning those of us with disabilities, need to be a part of it. Because if you start developing ideas, even with the best intentions, but you don't include somebody with a disability to give you feedback, you're going to miss things. And it's not for a malicious reason, it's just because you don't know. It'd be the same thing if we're trying to do something for women, and no offense, Ian, we want women involved in the discussion. So it's this idea that as we're making plans, we make sure that people with disabilities are in the room, whether it be really or virtually now because of COVID, that we have a voice and we can give our 2 cents, so that when things are misunderstood, we can say, hey, that's a great idea, but it might not work because of A, B, or C, or give our own perspective.
Great. And Sherry, as a practitioner on the ground, tell us what you've been doing in terms of including people with disabilities and maybe some new ideas that you're planning to try.
Sure. So for the trail project that we're currently in design on now, we've reached out to other tribal departments to obtain information about the tribal members here at Jemez who do have disabilities, so that we can actually personally reach out to them and include them in the design process. So we're now assembling a list of people that we can contact either via phone. We aren't doing the door-to-door thing as we had planned due to the pandemic. So we'll probably reach out via phone or community meetings specifically. Another good advocate we have is our librarian. She is disabled and she's just an awesome person and knows so many people in the community. Our housing department installs a lot of ramps and like handlebars in restroom facilities for people with disabilities throughout the Pueblo. So they've been a great resource to find out who our constituents are, who we can personally reach out to and include in the process. We also are sure to offer our information during planning and design via multiple avenues. So we do in-person community meetings, which we can't do right now. We do virtual meetings. We also do surveys, anonymous surveys. We usually hand out flyers. We this year, after the pandemic began, we started a Facebook page and Instagram. So we're on social media as well. So we're trying to reach the whole community, but specifically with disabled members of this community, we are working with the other tribal programs, public health, social services, the housing department, our awesome librarian. So that's a good way to find out who it is we want to personally reach out to get input from them on the design of our trail project.
Yeah, great. And just staying with you, how is the data on people with disabilities in your community? Is there room for improvement there?
Definitely. When I reached out to the tribal programs initially, the housing department is one of the only programs that has, it's not even a comprehensive list. It's just the people that have sought assistance from them. So I think we could do better in developing like a database of the folks that we need to be reaching out.
Mm-hmm.
Data is slim for sure.
Yeah, great. Well, I appreciate all the questions that have come in, and I'd like to invite Yamelith to switch your camera on now, Yamelith, and join the panel as we move to some of the audience questions. And the first one's for you, actually, Yamelith. Any surprises in the research that you conducted?
Yeah, I think the most surprising thing for me was really around the public health data and really the prevalence of disabilities in American Indian and Alaska Natives. And diving deeper into that data, I saw that regardless of any age group, American Indians and Alaska Natives still had the highest prevalence of disabilities. And then that those pedestrian fatality rates, studies have found that Native Americans are vastly more likely to be killed while walking than any other racial group. And that to me was really alarming and really emphasizes the importance of inclusive active transportation in the built environment in general.
Yeah, thanks, Yamelith. Here's a question about community engagement. Could you speak more about community engagement, for example, with amputees? I think this is a two-part question, with amputees and also challenges for folks that are rural and without internet. Let's see, maybe Claire, would you like to take that one first? And I know
okay, I'm
there
here.
you go.
Yeah, to touch upon the second part, as far as rural areas, that's forever an issue that impacts the disability community. Transportation is very it's lacking. There's a hard way for people to get from point A to point B, which is hard for everybody in rural areas. But then when you add on a disability, it presents even more challenges because, you know, if you have a disability, you probably can't drive. So then if you can't drive and there's no public transportation, you're in a difficult situation. So that's an issue that is talked about continually in the disability advocacy world on how can we better accommodate this community. And I wish there was a magic answer, and there's not, but it's something that is continually discussed and trying to find ways, because oftentimes people think, well, if you have a disability, you're going to move to the city, right? In fact, I grew up in a suburb and I said, I'm out of here. I want to live in a bigger city. So I moved to DC so I could have better options. You shouldn't have to do that, though. If you want to stay in a rural area, if you want to stay in a tribal nation area because you like that and that's where you're from and you want to stay there, you shouldn't be forced to move to an urban area just to receive the accommodations you need. So I think that's why this is a really great program and great projects that are going to start, because we need to find ways where people can remain in the rural areas if that's what they so choose, but find ways to accommodate people with disabilities at the same time.
Right, thank you, Claire. And Sherry, your community is in a rural area. Issues with internet connectivity?
Soon to be solved, I hope. We're installing fiber optic throughout Jemez Pueblo. We have been doing that for since June is when we started, and we should be done by the end of December. We also have a community Wi-Fi cell tower. The cell tower infrastructure is up, and we are just this month going to be installing all of the equipment so that the community will have access to Wi-Fi. And then so we do have some challenges there, but we're hoping and all the households that want them will be receiving a router so that they can have access to that community Wi-Fi. And then regarding transportation, the Pueblo of Jemez is fortunate to have a transportation department with kind of shuttle buses where we can bring people to community meetings, and that would just take coordination between our department and the shuttle service. So I appreciate that question, and we'll definitely have that on my radar to have the shuttle service available when we do get to have community meetings again.
Yeah, thanks. And Hosky, as an advocate, have you worked with amputees, and are there any particular challenges or solutions to share with that population?
No, not really. Not with amputees per se, but of course, a lot of our people end up in using wheelchairs for one reason or another. And one of the biggest problems we had on the Navajo Nation is we have a transit system that goes through the Navajo Nation, and we've been working with that department because they lack wheelchairs on their buses. And so over the 10 years that we've been working, now they're telling us at least 80% of their buses are wheelchair equipped. We also, New Mexico, Arizona, and Utah State Department, transportation departments donated bus shelters so we can put along the bus routes. And those still haven't gone up yet due to right-of-way issues that are still being worked out. And so, and our parking lots are such that they're, when they try to access a building to seek services, they're rocky, sandy, inclement weather makes it real muddy. Sidewalks are higher than the parking lot surfaces. Ramps are an issue. Getting into the doorways because doors are too heavy. People who are in wheelchairs who have spinal cord injuries lose a lot of their hand strength, and so can't open those doorways. If it's a regular doorknob, they have to have the C-shaped leverages. So all these issues we're still addressing, and it does impact their ability to access services.
Yeah, thank you, Hosky. Quick question for you, Emily. Mobility audits. What are they, and how does somebody perform one?
Well, it's going to be a little bit different for me because I'm kind of speaking under the, with the lens of the Americans with Disabilities Act. So a mobility audit it basically would be sort of a walking or rolling audit of your public rights of way. So, anywhere that somebody is going to be have pedestrian access, auditing whether those are accessible. And in the lens of the Americans with Disabilities Act, that would be a component of what we call a self-evaluation and transition plan, which is a way that a community, a business, a government can kind of take a look at itself, find where the challenges are, find where the really sort of bad and accessible areas are, and then develop a plan to remediate those things and be able to prioritize based on what are the areas that are impacting people the most.
Great. So that sounds like a strategy to include people with disabilities and engage those lived experiences into the planning process. So I just want to go around with the rest of you and ask for some ideas of sort of specific strategies or projects, small projects maybe, that could be implemented. Yamelith, what would you say in answer to that question? Yamelith, you're muted.
All right, unmuted. So with a small grant, I think a good idea would actually be to conduct those mobility audits, gathering a few people in, after COVID or when there's more safety, but gathering a few people in your community to assess the environment, making sure that there's people with disabilities during your audit is always really important to make sure that those perspectives and experiences are also incorporated into the audit.
Great. Claire, what's your suggestion?
I think my ideal project would be to start with working with real people. So getting a room of people with disabilities together after COVID, literally in the same room so that they can talk about their wishes and the obstacles they face so that we can have real live ideas put down on paper, so to speak, and go from there.
Great, thank you. And Husky, a small project that you'd like to see people start doing to address this challenge?
I think individuals with disabilities, a lot of them are seeking services. So I would suggest a disability guide for individuals with disabilities. And then that disability guide is to compile all the disability services that are available, the contact information, what they provide in one booklet, and provide that to people with disabilities so they know where to go for specific kinds of services. The other thing is focus groups or surveys. A lot of times people think they know the needs and the issues of people with disabilities, but I think focus groups is one way to really find out what is the needs and the issues, and it is a more constructive way of addressing disability needs.
Great. And Sherry, you got the last word.
Well, I think for projects that have already conducted focus groups or community meetings or surveys, you could do something like signage for your project, for a small project, purchase signage for a shovel-ready project or a project that's about to begin. Yeah,
great. Well, I asked that question because we have opportunities for the audience to participate in some implementation going forward. Kelsey, if you could give me the screen share back, and I'll put my final slides up. There we go. And the next step in this project, which we've been working on for over 6 months now, having published the white paper, which is available at the America Walks website, and everybody on this webinar should have received a link to that. It'll also be featured in our next newsletter later this month. But early in January, we're going to hold a national stakeholders meeting to start to develop an implementation plan for the recommendations that are outlined in Yamelith's white paper. And we will also have details of a rapid response mini grants program at that meeting. We do have budget to award 2 mini grants of $2,500 each on a competitive basis to implement some small projects in 2 communities. The applicants could be a community, it could be an organization, it could be an informal group that comes together. We will have details of the process. It will be a rapid response process, and we hope that before the end of January, we will award those mini grants. So we are sending invitations to the National Stakeholders Meeting out at the present time from our list of advocates for disability, professionals in implementing accessibility, professionals in tribal planning and design and public health, and tribal leaders and advocates in those communities. But if you are interested in being part of the National Stakeholders Meeting and are not already on our invitation list, please email me there at ian@americawalks.org to request an invitation, and we'll add you to the list. It's a 2-hour meeting. We will be brainstorming in small groups about how to move this initiative forward, and then providing details of the mini grants program. And everybody on that call will be eligible to apply, and we'll have a rapid response process and award those 2 mini grants by the end of January. So with that, we are sadly out of time, and I do want to again thank our sponsors, the CDC, the Active People Healthy Nation Program, APBP, MIG, I apologize, BetterHelp, the Everybody Walk Collaborative, and NICPAD. Just a final call before we wrap up. Miracle Walks is a nonprofit organization. We survive on grants and donations, and we do provide these this webinar series free at the point of delivery with the support of our sponsors. But we do ask everyone to consider making a year-end contribution to Miracle Walks to help us support our programs. So thanks very much, everybody, for the panel, Yamelith, the presenter, and you, our online audience, for participating in this. And I look forward to keeping the conversation around inclusive planning in tribal communities going into the future.